Hi, I'm Ruth Regan, Chair of Medicine at the University of Rochester. So, in patients with sickle cell anemia, obviously, there are issues with anemia to start with, and also the pain crisis that they get. Now, chemotherapy itself, of course, can affect blood counts, but the good news is it more commonly affects white blood count rather than the red cells, which are the ones that cause anemia. So I think for a patient who has both sickle cell anemia and breast cancer, we certainly would be careful giving them chemotherapy, but we check blood counts at every cycle, regardless of patients have sickle cell anemia or not. So I guess we would probably be just a little bit more prudent or a little bit more careful in patients who have sickle cell. I'm not aware that there is an increased risk of having a pain crisis in patients who have sickle cell anemia and are getting chemotherapy, but it's certainly possible. And if that did happen, certainly we treat the pain very aggressively and also make sure that patients are hydrated. So I think one important thing for a patient who has sickle cell anemia while they're getting chemotherapy would be to make sure that they remain very well hydrated. So we'd really encourage them to take a lot of fluids and potentially bring them in for additional intravenous fluids as well. The other effects of chemotherapy, like nausea, I don't think would necessarily be any worse in a patient with sickle cell. However, if they are taking other medications, I suppose it's possible that there may be a little bit more nausea. Apart from that, the other things that we see, like neuropathy or issues with the heart, I don't believe that they would be increased in patients with sickle cell anemia. So I think overall, the most prudent thing would be to take lots and lots of fluids and ask your oncologist about maybe coming in for additional intravenous fluids. Keeping a very close eye on the blood count will be important, and then managing pain crises as you would normally.